Hi there, this is Nursing Education Videos. Today I will be going over the Hypomagnesemia and Hypermagnesemia Quiz for Nclex exam on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. So, this quiz for hypomagnesemia and hypermagnesemia will test your ability to differentiate the causes, signs and symptoms, and nursing interventions between those two conditions. The Nclex exam and your nursing lecture exams will ask you questions about how to provide care to patients with low or high magnesium levels. The questions on this quiz are some of the most common exam questions students are asked about hypomagnesemia and hypermagnesemia. And there are other fluid and electrolyte quizzes on the website. So this quiz will test your ability to differentiate between hypomagnesemia and hypermagnesemia. So question 1. A patient with a magnesium level of 3.6 would exhibit which of the signs and symptoms except? So a normal magnesium level is 1.6 to 2.6. 3.6 is hypermagnesium or hypermagnesemia. So I'm going to go over to the hypermagnesemia Nclex review notes. So the information here for signs and symptoms of hypermagnesemia. Remember the mnemonic lethargic. And that is the opposite of hypomagnesemia, where the body systems are experiencing hyperexcitability. So when someone has too much magnesium, they're just very tired. So very tired, if you think someone's very tired, they probably have low blood pressure. So lethargic, it's hypotension. Profound lethargy, that would be with hypermagnesemia. So that's not correct. So C, respiratory failure. And then D is hyperreflexia of the deep tendons. So with hypermagnesemia, we would have hyporeflexia, or absent or grossly diminished of tendon reflexes with the mnemonic lethargic. So based on this question and its answers, all the symptoms which would be exhibited for a magnesium level of 3.6 except for hyperreflexia of the deep tendons, D. 2. Magnesium is absorbed by what system of the body? A. Gastrointestinal, B. Hepatic, C. Lymphatic, or D. For renal. So magnesium is absorbed in the small intestine. So that is part of the gastrointestinal system, and it's excreted via the kidneys. Any issues with these systems can cause magnesium level issues. So the answer would be A, gastrointestinal. 3. Which of the following patients is most at risk for hypermagnesemia? So A, patient with alcoholism. B, a patient taking a proton pump inhibitor called Nclex. C, a patient suffering from Crohn's disease, or D, a patient with a magnesium level of 0.6 receiving IV magnesium sulfate. So if we scroll down for the causes of hypermagnesemia, the mnemonic is MAG, M-A-G. Hypermagnesemia is less common than hypomagnesemia, and it typically happens when you are trying to correct hypomagnesemia with magnesium sulfate IV infusion. However, other causes include magnesium-containing antacids and laxatives such as Mylanta or Maalox, Addison's disease, which is adrenal insufficiency, or the glomerular filtration insufficiency of less than 30 milliliters per minute in renal failure. This is because the kidneys are keeping too much magnesium. So on these causes, it does not talk about alcoholism. It does not talk about a proton pump inhibitor called Nclex. It does not talk about Crohn's disease, but it does say a patient who is receiving IV magnesium sulfate could put them at risk for hypermagnesemia. So it would be D. So a patient with alcoholism is likely to have hypomagnesemia because of decreased absorption of magnesium. A patient suffering from Crohn's disease would also most likely have hypomagnesemia because of decreased absorption. We're just going to go to the hypomagnesemia notes. So the causes here is malabsorption issues from hypomagnesemia, which is Crohn's, celiac, proton pump inhibitors such as Prilosec, Nexium, Protonix. So proton pump inhibitors could contribute to hypomagnesemia because it causes someone to absorb less magnesium. Next question, number 4. A patient is admitted to the ER. The patient receives dialysis on Tuesdays and Thursdays of every week and presents with a palpable AV shunt, thrill present in the left upper arm. The patient is extremely lethargic and family members are present to help answer questions. So lethargic would be related with hypermagnesemia, because in hypomagnesemia there's hyperreflexibility. So think about having too much magnesium means you are very lethargic. Too much magnesium means you're lethargic. So when collecting the patient's medication history, the daughter states her mother has been taking a lot of Maalox lately due to upset stomach. You note this is a significant finding. Which of the following lab values correlates with this finding? So Maalox is a magnesium-containing antacid and so it's a magnesium-containing antacid. So if someone takes too much Maalox, it means they're consuming too much magnesium. They are likely to have a hypermagnesium level, so hypermagnesia, magnesemia. Normal levels is 1.6 to 2.6. So answer A, It says magnesium level of 1.0. Answer B, magnesium level of 2.4. C, magnesium level of 3.6. Or D, magnesium level of 1.4. So in the case of hypermagnesemia, it would be C, magnesium level of 3.6, that causes the patients to be extremely lethargic due to them consuming Malox, which is a magnesium-containing antacid. Question number 5. A patient is being discharged after being hospitalized with a magnesium level of 0.7. So that is hypomagnesemia. After diet teaching with this patient, which statement by the patient warrants you to re-educate the patient? I love eating salads with kale and spinach. I'm shocked mackerel contains magnesium. C, I can't believe I have to give up dark chocolate. Or D, tonight I'm cooking fried potatoes with a side dish of peas. So in a case of hypomagnesemia, you want to eat more foods with magnesium. So we are going to go to the hypomagnesemia notes. So the mnemonic is always get plenty of foods containing large numbers of magnesium. A for avocado, G for green leafy vegetables, P for peanut butter, potatoes, pork, O for oatmeal, F for fish, so canned white tuna or mackerel, C for cauliflower or chocolate, which is dark chocolate, L for legumes, N for nuts, O for oranges, M for milk. So the correct answer for this question would be C. I can't believe I have to give up dark chocolate. The reason for this is the patient is actually giving up dark chocolate when they should be eating more dark chocolate, which would increase their magnesium level because they are because they have a hypomagnesemia level of 0.7. So they should have more dark chocolate. The answer is C. So question number 6. A patient's magnesium level is 0.9, which is hypomagnesemia. The doctor orders magnesium sulfate IV to replace the patient's magnesium level. Which nursing intervention takes priority? Assessing for hypertension. So a patient with 0.9 would likely have hypotension due to being lethargic. Well, actually, that's incorrect. So a patient's magnesium level of 0.9 is hypomagnesium, so they are likely to have hypertension. Or B, monitoring for deep tendon reflexes. Or C, monitoring for potassium levels. Or D, monitoring for skin turgor. So signs and symptoms of hypomagnesemia is mnemonic twitching because of hyperreflexibility. So the patient would be having hypertension as well as deep tendon reflexes, so involuntary movements. So for nursing interventions, is to place patient in seizure precautions for a hypomagnesemia. that could be the utmost priority, which is to monitor the deep tendon reflexes, where you place patient in seizure precautions to prevent patient from harming self. And then you assess for hypertension. And you monitor electrolyte levels like calcium and potassium. Because it also says here to may administer potassium supplements due to hypokalemia, where it's hard to get magnesium level up if potassium level is down. So the answer on this quiz, I think, would be B, monitoring deep tendon reflexes to prevent self-harm due to risk for seizures. And question number 7, which arrhythmia is patient who has a magnesium level of 0.8 most likely to experience? A, heart block, B, bradycardia, C, torsades de Pontes, D, normal sinus rhythm. So Google says torsades de Pontes. Could the patient be at risk of torsades de Pontes? So if we look at the hypermagnesemia, you would think someone is lethargic, so they're tired. If someone's feeling tired, they're probably having the low blood pressure, which is the hypotension in lethargic. And having low blood pressure, that could be due to insufficient heart pumping activity. So the information here, it says a patient with hypermagnesemia would have heart blocks and bradycardia because they are feeling tired. And then a patient with hypomagnesemia of 0.8, they're most likely to experience torsades de Pontes. So answer C. And torsades de Pontes is an abnormal heart rhythm that leads to sudden cardiac death. So on the National Library of Medicine at the National Center for Biotechnology Information, torsades de Pontes is a type of polymorphic ventricular tachycardia. So similar to the body being hyper-reflexibility, like being, I think the word was hyper-reflexibility. So the word is hyperreflexia. So if the patient's at risk for seizures, twitching, so their heart is also at risk for seizures and twitching. So of torsades de Pontes, of ventricular tachycardia due to hypomagnesemia. So that's what would make sense to me, is a patient with low magnesium level, they're at risk for seizures, and their heart is at risk for twitching, which would be the torsades de Pontes because of the ventricular tachycardia. So again, the answer would be C. And then number 8, on admission, a patient's blood alcohol limit is greater than 400 milligrams per deciliter. The patient reports drinking a 12-pack of beer on a daily basis. Which of the following conditions is this patient most at risk for? A, hypomagnesemia, B, hypermagnesemia, C, hyponatremia, or D, hypernatremia. So because a patient is consuming high levels of alcohol, that can cause their kidneys to excrete magnesium, which would put them at risk for hypomagnesemia. So because they're drinking too much alcohol, their kidneys are constantly excreting magnesium, which is removing the magnesium, so they are at risk for low magnesium levels, which is hypomagnesemia. 9. A patient has a magnesium level of 1.3. Which of the following is not a sign or symptom of this condition? So normal levels of magnesium is 1.6 to 2.6. A level of 1.3 is hypomagnesemia. Hypomagnesemia would be increased hyperreflexia. So we said earlier that they are at risk of, so the options are A, tall T wave and depressed ST segment, B, torsades de Pontes, C, positive trousseaux and Schoffstecks, D, absent deep tendon reflexes. So this is a hypomagnesemia, which equals to twitching equals to torsades. We could cross that one out first. And they would be having hyperreflexia. So they would actually have quite a bit of tendon reflexes. So you can choose D right away, which the question asks which of the following is not a sign and symptom of hypomagnesemia, which is the absent deep tendon reflexes. That would be a sign and symptom of hypermagnesemia. The other information here is that a tall T wave and a depressed ST segment, as well as a positive truce. Well, a positive Schoffstecks sign is a sign of hypomagnesemia. I'll double check the trousseaux. So it's actually pronounced as trousseaux sign, and that is due to hypokalemia, which is in correlation with hypomagnesemia. So it says here signs and symptoms of hypomagnesemia on registerednurseiron.com is trousseaux sign would be positive due to hypokalemia. So the answer for question 9 would be D. Absent deep tendon reflexes is not present in hypomagnesemia level of 1.3. And then question number 10. A patient's magnesium level is 3.0, which is hypermagnesemia because normal levels is 1.6 to 2.6. The cater associate brings the patient a dinner tray. Which item on the tray would you remove to ensure the patient does not eat? A, macaroni, B, tomatoes, C, kale, or D, onions? Because I did this quiz before, it would be C for kale, but we would go through the information here to always get plenty of foods containing large numbers of magnesium. So green leafy vegetables has large numbers of magnesium in it, and a patient's magnesium level is 3.0, so it's hypermagnesemia, and that you would want to discourage them to eat foods with high levels of magnesium. So withhold foods high in magnesium, such as green leafy vegetables. Macaroni, tomatoes, and onions are not included in this list. So the answer would be C, kale, for a patient with magnesium level of 3.0. So after you're done taking the quiz and click submit, the page will refresh and you will need to scroll down to see what you got right and wrong. In addition, below this quiz is a layout of the quiz with an answer key. If you want to print off the quiz, just copy and paste it. Don't forget to share this quiz with your friends. Please do not repost on other websites, however. Alright, so based on those answers, your results are here. Your grade is A. Percentage of what you got right is 100. So that is because we reviewed the notes and practiced this information. I hope by reviewing the Nclex review quiz and Nclex review notes helped you better understand hypomagnesemia and hypermagnesemia. And thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursrn.com for more information and check out their YouTube channel as well. I hope everyone has a good day. Thanks.